From witnessing trauma, nursing students learn that healing begins not only in caring for others, but also in strengthening the soul within. For it is possible to uncover resilience in pain, compassion in chaos, and the quiet strength to heal while carrying the stories they once witnessed. A pleasant day, ladies and gentlemen. We are the Group 2A of PSN 3A. I am RYLE Marie Fernandez, and together with me are MIRIELLE, RENEE, ANGELIQUE, ESMORES, BAYANI, GARCIA, ALYSSA, TRICIA, GENOBIS, and JAYCEL, GONZALES. In the midst of clinical practice, nursing students often encounter traumatic moments that profoundly shape their emotions, perspectives, and journey toward becoming compassionate healthcare professionals. Hence, we present to you a research study entitled Lived Experience in Traumatic Incidents Witnessed During Clinical Exposures Among Nursing Students.
The purpose of this study. The study explored the lived experience and traumatic incidents witnessed during clinical exposures among nursing students. For the research design, the study uses a qualitative phenomenological approach to explore the experiences of nursing students who have witnessed traumatic events.
The study used purposive sampling in selecting 10 level 4 nursing students, 2 candidates from each section. Eligibility requires assignment to multiple clinical areas, experiencing at least 3 traumatic incidents, and completing a minimum of 4 semesters of clinical exposure.
The study used a researcher-made interview guide to explore nursing students' traumatic clinical experiences. It includes 3 parts, which are the demographic data to identify the participants' background characteristics relevant to the study, one overarching question to capture the participants' central lived experiences regarding traumatic incidents, and 4 open-ended questions with follow-ups to encourage detailed narratives and deeper exploration of the participants' thoughts, feelings, and experiences.
And now, let us proceed with the results and discussion, which is organized into 4 major themes derived from the participants' responses, reflected by their emotional, psychological, and professional experiences. For the demographics, we have 2 level 4 participants from each section, 1 male and 1 female, with perceived importance of religious affiliation, exposed to delivery, OR, ER, medical, ICU, and psychiatric units with at least 3 traumatic incidents and completed at least 4 semesters of clinical exposures. Pseudonyms were allocated to maintain confidentiality.
Theme 1. Addressing the reality of life and death. Sub-theme 1. Struggling with pressure and uncertainty in the first CPR. Samuel, quote, I didn't want to break down while I was doing the CPR. I really wanted to revive the patient, but I wasn't able to, unquote. Second sub-theme, facing the reality of patient loss. Kara, quote, I've experienced death. I've experienced this 4 times already, unquote. Third sub-theme, processing emotional distress in post-mortem care. Lila, quote, it was because during the post-mortem care, every time that I closed my eyes, I remembered the face of my patient. During those 2 weeks, I cannot sleep if the lights were off, unquote.
Next, for our second theme, coping with trauma through holistic healing. For the first sub-theme, spiritual support and prayers for comfort. As stated by Leo, I am also grateful to God because He gave me the idea to write everything in the anxiety logbook, my experiences and frustrations. Next, for the second sub-theme, finding meaning and understanding in traumatic experiences. As stated by Honey, there is the pressure which drives us to do better in our next exposures. And lastly, for the last sub-theme, expressing emotions through crying or journaling. As stated by Kara, I have to cry it out because if I don't, it will eat me away.
Theme 3. Shaping student nurses' resilience and maturity. First sub-theme, extending compassion through care to patients and folks. As one participant shared, I saw the folks break down and cry, but I told myself I am a nurse here and I should do everything that I can. Next sub-theme, significance of nursing in healthcare. As participant Silo said, that is why while we are still nursing students, we ensure that every duty we live by little things we can do to help our patient. Last sub-theme, enhance understanding, confidence, and readiness. Participant Samuel shared, I can confidently do procedures properly on my own now. even handling critical patients.
For the fourth theme, the role of support systems in handling traumatic incidents. For the first sub-theme, RELE group members and peer support. As participant Silo shared, of course, my usual support person, particularly my partner in my RELE group, so I'm very grateful that I have a strong support system. The second sub-theme, debriefing from clinical instructors. As participant William shared, you will have that peace of mind since you have reflected on it and you have feedback from your clinical instructor. The last sub-theme, sharing experiences to a guidance counselor. As participant Matilda said, we had a debriefing in the guidance office. We were able to share our feelings and experiences, and it helped. She gave us words of wisdom, and she said, it's normal since it's our first time.
Recommendation. To address the findings of this research, a multifaceted approach is required in which hospital nursing service administrators prioritize safety through strengthened protocols and simulation training, while university administrators anchor the academic environment with proactive well-being policies. On the ground, the College of Nursing faculty should facilitate debriefing and resilience activities, complemented by guidance counselor who must involve their support services to better teach coping mechanisms. Success also relies on the domestic sphere, where parents and guardians provide a foundation of open communication, and on the student nurses themselves, who must embrace self-care and actively utilize available resources. Finally, future researchers are encouraged to build upon this work by conducting deeper longitudinal studies into the specific strategies that foster long-term professional resilience.
Traumatic clinical events are complex, transformative experiences that mold fourth-year nursing students into compassionate, skilled professionals. Trauma is an essential part of the nursing educational path that requires nursing programs to provide dedicated emotional guidance. For the study's references, you may scan the QR code in the upper right corner. And that concludes our presentation. Thank you so much.